allowed to attend post-secondary to still qualify for some of these programs. Those are big policy challenges that exist in this field that I think if we're going to seriously talk about how do we overcome low-income, non-traditional student persistence and completion challenges, that we're going to have to look at aligning these policies. Just briefly, I want to highlight a couple things from the paper. One, many of you may be wondering, are students eligible for public benefits? Are college students eligible? Unfortunately, it's not a yes or no answer for those of you who do any work in this area. Many states tie eligibility for state-administered programs for those pursuing post-secondary to part-time or full-time employment, which is a real challenge when we think about those 20 hours, despite what all the research shows. Two of these programs that I want to briefly highlight for you are SNAP and child care. SNAP has a complex set of rules. Some people think college students aren't even eligible for SNAP because the rules are so complex. But there are a set of exemptions for low-income students, particularly non-traditional students who are attending at least half-time. For instance, if they're working at least 20 hours a week, if they have children below a certain age, or if they're in a certain occupational-oriented program. With child care, states have a high degree of flexibility in terms of determining whether or not post-secondary attendance is even an allowable use for child care. So in a handful of states, you can't even use child care funding to pursue post-secondary education and training. In other states, you have to team that time with 20 hours of work a week. Or you, in some states, don't provide coverage for homework time and that kind of thing, so you start getting into some of the complexity of the rules. And unfortunately, the availability of child care assistance is severely limited. About 1 in 7 families across the country who are in need of child care qualify for those subsidies. And so obviously, in talking about child care, you can imagine a couple of those recommendations. States should ensure that their child care policies support post-secondary education and training attendance and do not limit it to those who are working, provide it for homework, and then also need to consider allocating more money for those funding streams, or even considering Minnesota has a standalone child care grant program for post-secondary students that's worth keeping in mind. On the treatment of public benefits by the federal student aid system, they're largely exempt except unemployment insurance. And this is an interesting thing I just want to flag, is that the student financial aid administrators, like Angela, have discretion as to whether or not they want to disregard, meaning take that money off the table, not use it in the financial aid calculation. And in the height of the Great Recession, DOL and Ed put out guidance to financial aid administrators encouraging them to not count UI benefits in the calculation of income. And so that is one area in which there is some challenge. The other area that provides some challenges around the treatment of student aid in calculating public benefits. There's a fine line here between direct educational expenses and indirect. When I say that, you may say, what's the difference? Direct is tuition and fees, indirect are living costs. This seems like a pretty antiquated way of organizing our view toward education costs, given the fact that increasingly things that used to be an indirect are more direct costs, and given the escalating unmet need that students face, needing to steer more of that, acknowledge that much more, that there isn't this sort of artificial trade-off between indirect and what's direct, that actually those indirect costs like food and housing are essential for a student to be able to persist in completing college. Both SNAP and housing are two policy areas that treat student aid differently depending on it, whether it's direct or indirect. There's much more detail about that in the paper. One way of potentially getting at this challenge would be to ensure that that financial aid, all of financial aid, is disregarded in these programs, and that it's considered also not taxable. And I also want to flag that for Medicaid, this has been a great opportunity. I was really thrilled to hear that the website almost broke down again last night because there are so many people applying for Medicaid. This is a huge change in policy for students over the last few years, largely Low-income independent students were not eligible for Medicaid. With the Medicaid expansion up to 138% of the federal poverty level, a lot more students are eligible for Medicaid now than in the past. And health care has been a barrier that some students have identified as a reason that they've had to drop out, healthcare expenses. And so the Medicaid changes are huge in that respect. One unfortunate change is due to how income is determined for Medicaid is that taxable student aid, and that means any aid going beyond direct educational expenses, again, there it is again, is counted as income in Medicaid and the premium tax credits. And so that's an unfortunate policy that we hope to see will change over time. So we hope that over time, like I said, those policies become more responsive. HEA has its own work to do as well in terms of being a supportive funding stream for the kinds of innovations that Angela and Mark are going to talk about from their experiences. We encourage federally funded programs such as TRIO and the Title III and Title V, strengthening institutions dollars to be allowable, that benefits access be allowable uses, particularly when we think about minority serving institutions and those high levels of unmet need that I talked about for students of color. We also think that Ed could do a better job encouraging and educating students about the availability of public benefits. They could provide information on the studentaid.gov portal as they do around veterans assistance and other forms of assistance. Ed also does a ton of outreach to high schools, to one-stop centers, to libraries, to try to help people fill out the FAFSA, and we think that Ed could also be educating students about the availability of refundable tax credits as well as public benefits at that time as well. We'd like to see the development of an interagency working group, and this is a big one because of because no one agency controls all of these programs. No two agencies do, actually 6 or 7 control it. And so if we're going to see an alignment of policies, we would like to see in this last year of the administration some collaboration across departments to try to sort out what are some policies that can change to better support low-income students persisting and completing. In closing, there are a few main challenges in doing this work, and I think it'd be remiss to not highlight them. One is the fact that these policies aren't aligned very well. So even though we fully support institutions trying to connect students to public benefits, there needs to be some policy work going on in tandem with that work on the ground at institutions. Also, colleges need to sort this out, and it's not an easy challenge, as Angela will talk about, but we do see more institutions developing that capacity. Third, many of these social programs are stretched. The waiting list for subsidized housing in New York, I believe, is over 10 years long. I mentioned the child care numbers that are daunting as well, and that sequestration over the last few years has been particularly tough on those. And then I can't ignore the fact that arguing that more people seek out public benefits is also a little bit politically loaded. I like to think back on one of the presidents of the Benefits Access for College Initiative. Benefits Access for College Completion Initiative, Ed Hughes, he used to be the president at Gateway Community Technical College in Covington, Kentucky, said it's a short-term investment for long-term gain. And he was in an environment in which people were saying, really? Get more students on food stamps? And he said, yeah, this is my strategy. More students are going to get through, they're going to graduate, they're going to become taxpayers, they're not going to need assistance anymore, and we're going to have more successful graduates that way. So I think there's some reframing that's going to have to happen in this field as well. So I appreciate the opportunity to talk to you about this and look forward to hearing what my colleagues have to say.
Thank you. Good morning. I'm always so excited to talk about this. As Amy Ellen knows, we feel like we've been around the country on this movement and trying to get people to think about this. And one thing I want to talk about specifically around why it's so important for community colleges. She did share with you some of the data about who community college students are. and why that's really important. I've talked to a lot of schools who are not community college who want to do this work, and they find it even more challenging because of the student population, primarily dependent students and things like that. But I want to start by just telling you kind of why we got involved and why it was so important for Cuyahoga to be a part of this experiment, or for me, this movement now, and kind of thinking how health benefits really could help our students. We were invited to participate in initially applying for a grant to help support this, but we knew from the very beginning that if we got involved in this work and we were selected to be a part of this, this would be sustained. And we have to figure out in our organization, where does it fit and how does it fit, and then how do we continue to do the work. We conducted a gap analysis to really understand if our students would be students that could qualify for some of the benefits that you heard about earlier. And what we knew very, very quickly is that 80% of our students who receive Pell Grant, and that's 20,000 students at our institution who receive Pell Grant, receive the maximum Pell Grant. So 80% of those students who receive Pell receive the maximum Pell, so those are the neediest students. But what we learned early on is many of these students either already had benefits, knew a lot about benefits, maybe we're in a gap between how they keep their benefits, but their bigger gap was how do they stay enrolled and continue to be academically progressing, because that was contingent upon them receiving and continuing their benefits. So our program started in our academic affairs area, where our academic affairs looked at the completion and success initiatives around that.